Did you know that the medication you're taking could be making your disease process worse? If you're suffering from an inflammatory disease and or an autoimmune disease, this may be a key piece to your case. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. It is a known fact that your body can develop antibodies against medications that you take. This means that your immune system sees the medication as an enemy and attacks it. And this can be an inflammatory driver in your case and exacerbate the disease process or symptoms by stimulating the immune system to work more against another target versus having the intended effect of the drug, whatever that drug is that we're talking about. An example of this is the drug Humira. It's a known fact that people can develop antibodies to Humira, and there's testing looking for anti-Humira antibodies. So if you have Crohn's disease or rheumatoid arthritis and you're taking Humira, your rheumatologist is likely, if you're taking it long term, will likely check for anti-Humira antibodies. And so if you're one of these patients who has been on this drug for a long time and it has stopped working or things have gotten worse, you may want to ask your rheumatologist if they've run antibodies to the drug, and if not, will they? Because if you are taking a drug to which you've developed antibodies against, that's gas on the fire versus beneficial for you. Another drug that this can happen against is Novolog or insulin. It's one of the insulin drugs. So if you're a diabetic who takes insulin and Novolog is the insulin medication that you use, it's potential to that you're developing antibodies to that medication. So if you have type 1 diabetes that has worsened and you're taking Novolog, it may be that you've developed an immune reaction to the medication. And so again, you would have to discuss with your provider whether or not that's happening and should you move to a different medication that your immune system isn't reacting to. It's also possible that thyroid hormone itself, T3 and T4, that you can develop antibodies to the hormones itself, both your own and bioidentical drugs that you're taking. So, or bioidentical thyroid hormone that you're taking. So there's multiple diseases that are impacted by this, and so if you're a person that is being managed for an inflammatory disease, an autoimmune disease, and you've been on a medication for a long time and it used to work but now you've gone downhill recently, then one consideration that you have to think about is has your immune system developed antibodies to the specific drug you're taking? And if so, that's an inflammatory driver and probably worsening the case, and you're not getting the intended benefit from the drug. So that's a big conversation to have with your managing provider and to investigate so that if it's at play, you can make the changes and get back on track to receiving benefit from the medical treatment. Also, you want to think about, if that's going on, why is the immune system creating antibodies to things that it maybe shouldn't? And so even if you're taking these drugs that are targeting one specific pathway of a given disease process, you still want to support the overall immune system and immune system balance. And this is where functional medicine and natural medicine comes in, because natural medicine and functional medicine is going to investigate where the holes are in your immune system or which way it has gone awry and bring that back to balance, so that when you're using a Humira, for example, the Humira can do its job, which is block TNF-alpha, which is a major inflammatory cytokine, and then you can help in an adjunctive way, you can help the Humira do better by calming down the immune system, therefore calming down the attack on self and allowing the effect of Humira to be even more beneficial.